This presentation is brought to you by BrainCoreTherapy.com. Addressing your fibromyalgia prognosis. Your fibromyalgia prognosis can be intimidating and confusing. Luckily, there are many treatment options available that can significantly improve life for fibromyalgia sufferers. After being diagnosed, many people seek to address and understand their fibromyalgia prognosis. Fibromyalgia is a complicated chronic condition that can cause a lot of emotional and physical distress for sufferers. Fortunately, the prognosis is not definite. Patients have shown a range of responses to different fibromyalgia treatments, but there is hope of improving your symptoms, especially if you're proactive. When looking at your fibromyalgia prognosis, it is important to understand how different people's experiences with the disorder can be. There is no definitive answer for whether your symptoms will worsen or improve. Each year we get closer to understanding the disorder, but here are some facts we know as of now. Doctors who extensively treat fibromyalgia estimate that around 1/3 of patients will make significant improvements, 1/3 will stay the same, and 1/3 will experience worsening symptoms. Fibromyalgia sufferers experience greater psychological distress and a greater impact on quality of life than those with other chronic pain conditions and require treatment to address symptoms on a range of levels. Research shows that patients treated with multidisciplinary approach, including medication, physical and mental therapy, showed the most significant response to treatment. One positive thing about your fibromyalgia prognosis is that every year more research is done to find effective treatment. Over the past decade, the medical community has made great strides in better diagnosing and relieving the chronic pain disorder. It is generally recognized that as everyone's experience with fibromyalgia is different, the response to treatment will be different as well. That means you and your doctor may have to experiment with different combinations of treatment to find a plan that's effective for you. There's not one clear-cut cure, but studies have shown that fibromyalgia sufferers find success by combining treatments to address symptoms on all sides. Some of the most effective treatments for fibromyalgia include medication, exercise, physical therapy, and neurofeedback therapy. There are a number of medications available for fibromyalgia. None of them can cure the disorder on their own, but pairing them with other therapeutic treatments can increase their effect. The 3 most commonly prescribed medications for fibromyalgia are Lyrica, Cymbalta, and Savella. Typically, only around 35% of patients will respond to the medication, and they do come with side effects, so a doctor should be consulted through treatment. There are a number of medications available for fibromyalgia. However, none of them can cure the disorder on their own, but pairing them with other therapeutic treatments can increase their effect. Physical activity has been shown to be incredibly helpful for improving your long-term fibromyalgia prognosis. Studies on patients have shown that vigorous exercise is not necessary and can actually worsen your symptoms. However, some mild stretching and short walk daily can make a big difference. Doctors suggest that fibromyalgia sufferers who even get 5 minutes of light exercise each day show a much better physical prognosis over time. Physical therapy seeks to alleviate the many consequences of fibromyalgia. It is particularly beneficial for treating the postural and muscle fatigue and weaknesses that often accompany this disorder. Physical therapy can be easily combined with other therapies to increase its benefits. Neurofeedback therapy works to redirect a patient's brainwaves to healthy and organized patterns. By correcting off-track brainwaves, neurofeedback creates a more stable and functional brain. This therapy has been shown to have no side effects and has been effective in treating a variety of neurological conditions like chronic pain, panic attacks, and anxiety. Neurofeedback can be a great therapy option for fibromyalgia sufferers. To learn more, please visit the link shown below. What works for you? It can be scary when you first begin addressing your fibromyalgia prognosis. However, with patience, research, and dedication, you stand a great chance of finding relief. Be kind to yourself and honest about your feelings and responses to treatment. If something isn't working, try something new. Only you can decide what treatment is most effective for your body. For more information on fibromyalgia, please visit our website at www.braincoretherapy.com.